Okay, so ladies and gentlemen, I'm really delighted to be here today with you and to give you a few ideas about the way in which we could probably create knowledge, produce knowledge, and also share knowledge, because I really think that it is one of the most important points in a health promotion, that producing knowledge and sharing knowledge are in fact exactly the same process. So, the title of our talk could be a bit strange for people. What does it mean, ecosystems? Why knowledge production and sharing at the same time are new? So this is very few questions, and at the very beginning of this session, I just would like to highlight a few important things from our point of view. The first thing is the why. Why do we need to work again on this question of knowledge in health promotion, also in health education, in public health in general, in community health? This is just because we are working in a field which is not defined by core principles and paradigms. We are working in a field which is based on social practices, which means that it is totally different, because we don't have to work in the reference of a theory. We are working in reference to the people, the social practices, the needs, the changes of the society. And if you try to make clear what are the different dimensions of health promotion, you always find that you have at least 4 groups of social practices. It's not only one, you implement health promotion. It just does not exist. Because health promotion is, first of all, the practices of the people themselves. Because who produce health? This is the people themselves. This is not you. This is not me. So health promotion, this is, first of all, the practice of the people. The second practice in health promotion, this is our practice. The one of the professionals, but also the volunteers, the people involved in association networks. This is the people that try to change the factors that influence health of the population. Second practice in health promotion. The third, which is very important too, is the practices of the policy makers and the institutions, the one that try to change the living together and the way of life of the people at the local or global level. And the fourth one, this is the one of the innovators. This is the academics. This is the people working in big NGO or for the United Nations. So why do we need to rethink the knowledge production and sharing in our field? This is just because we have to take into account the fact that we need knowledge, not only about the implementation process or the guidelines. We need knowledge about the way in which people produce health, the way in which professionals contribute to have an impact on the health determinants, how policies change these factors, and how innovators influence these processes. I would like all of you to have that in mind, because if we want to produce relevant knowledge, we have to think at these 4 levels from the beginning. And of course, at the end of the end, this is always the people who decide. And we always have to have that in mind. So yes, why having new knowledge production and sharing ecosystems? This is because we need to have a better understanding of this different kinds of practices and the way in which they influence health. First. The second one is directly in line with what Luis just said previously. What are we talking about? There's no definition. What defines the activity in the field of health promotion, but also in general in public health and in prevention? It's always 4 key ideas. A strategy based on a vision, which have to take together different kind of knowledge, and we acknowledge the complexity. The strategy, all what we are doing in the intersectoral work we are going to talk today, is always based on a strategy. This is actions that are put together to have an impact on the health of the people. The second thing, this is exactly what Louis said, is that health promotion, as well as public health, is based on a vision. Health promotion, the vision is specific. This is emancipation, freedom, or empowerment. This is by definition what is the aim and the general goal. The third key point, and it's important to have that in mind for this morning and this afternoon too, with the second part of the pre-conference with Orkan and his team, this is the fact that we need more than one kind of knowledge. You know, there's a myth in our society. We have research, research produces data, and we implement what comes from research. Never work like this. Not at all. We always have together at the same time different kind of knowledge, the know-how, the people, the real people, what comes from the research, but also all what comes from the community, from the society, and from the culture. This is absolutely critical, because if we want to produce relevant knowledge for health promotion, how could we miss that? The key idea, probably, and this is something we're going to discuss, and Marie-Pierre are going to talk about that during the round table. This is the question of what we call, this is not us, this is a colleague of us called Boaventura de Sousa Santos, the question of the ecology of knowledge. In health promotion, how can we put together all this knowledge? And the last key point, this is a question of the complexity. A lot of dimension in health. Of course, spiritual, emotional, but more than that, the foundation of culture. And never forget, health is always a question of power. Even if in the good guise of health promotion, we are gentle and caring and trying to contribute to the development of each other. Yes, 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 of course. But behind that, you have the Western model, always. And of course, it's a kind of neo-colonial ideology. And we are in that. And that's the same with the most vulnerable part of the population. We cannot miss that. So, probably, what is critical for this meeting today is to have an idea that we have building blocks. And if we want to produce knowledge about intersectorality, we have to refer to the 4 practices and the 4 building blocks in order to have a shared understanding, a kind of better recognition at the global level and also at the local level of what is done in the field of health promotion to gain visibility and probably to create an identity and to have an impact upon policies. Third and last idea. If you want to produce knowledge in health promotion, by definition, you have to have in mind that there's always 2 goals, a dual aim. One is producing knowledge, but the other one is to contribute, to orient the social changes. This is at the same time, this is not 2 processes. This is why the title of this talk is Knowledge Production and Sharing. Because in health promotion, it's the same unique process. So what we're going to work on this morning is to see how the data we have from research and practices in intersectorality could lead us to, 1, produce knowledge, and 2, contribute to social change. The second idea is that these data are not the final theory about health promotion. You know, this is more like a map of the ocean. You can have an idea of everything. What you could do is to have buoys, beacons, lighthouses that shows what is important, what is dangerous, and what's not. So which means that what we need, and this is what we're going to do today, is to think in terms of strong multidisciplinary approaches with the people, of course. We have to have in mind the question of the local and the individual knowledge, and the question of the articulation, the very close articulation, between the production of the knowledge, the know-how of the population, and the cultural practices. So, yes, our question today is not to think at what kind of knowledge are we going to publish in global health promotion next week. The question is, what is the relevant knowledge for health promotion? So the how is very simple. You have to take together all the pieces of the puzzle. We have to be knowledge-oriented. This is something we probably miss in health promotion at the time. Our identity has to be based on knowledge, not only, the evidence-based knowledge, but also the cultural practices, the individual practices, knowledge centers. Health promotion, first of all, it's knowledge. And of course, to make it visible and understandable, this is what we're going to try to do today with robust methodologies for production and also teams of research and practitioners with a high level of cultural sensitivity and a decentralized process. And I would like to share that with you. We have to think at the next generation. Producing knowledge and sharing knowledge, what we are doing now, is for me mostly to prepare the next generation to have the skills to contribute to the development of health promotion. There's many initiatives. Our meeting today is one of them. Now, the second part of the talk is to focus on intersectorality and to see, following this comprehensive view, we could move together on this question of intersectoral approach.